has there been any published data that has stuck out to you or really kind of surprised you so far in just the early stages of us learning more about COVID-19?
I think what has come out in terms of Chinese data, or even the French data that was published in New England Journal, these are case series. A lot of them don't drill down as much as we might like on neurologic pathology. Like, so for example, having a headache, is very common with viral syndromes. We would not necessarily consider that a neurological sequelae, although that's the most commonly reported finding in a lot of these case series. Certainly we would like more data, more neuroimaging, more substantiation of certain diagnoses, and a larger series, plus really kind of a series looking at what's going on globally, because it may vary regionally, and we certainly know that there are different strains of this virus, and which may perhaps perform or differently. So the European versus the Asian strains may have different degrees of neuro proclivity to infect the nervous system. We don't know yet. So I think having the global project that we're working on is going to be pretty useful, because we'll be able to make some of those comparisons internationally to see what the effects are. We're also including a pediatric component as well. So there's really a paucity of data amongst pediatric patients, thankfully, because it's so much less common to severely affect the pediatric population. But we do certainly need to understand more about what's going on in kids that have COVID. And there's probably, certain pediatric populations that are more susceptible or prone to having poorer outcomes than the general pediatric population.